Now, I first raised the fact there'd been a buy-up in Wuhan of PCR equipment, that's coronavirus testing machines, in our documentary, What Really Happened in Wuhan. Here's John Ratcliffe. He's the former head of the Director of National Intelligence, responding to that revelation. How significant would this purchase be?
Would be significant.
Is it a smoking gun?
Ultimately, I don't think there's ever going to be one specific smoking gun. I think there's more than just smoke here. I think there's fire from a whole bunch of different sources. I think that would be another compelling piece of evidence if you need more. I don't need more.
And you can watch the full Sky News documentary on YouTube if you haven't seen it yet. But now, for the first time, we can detail just how many PCR machines were bought in Wuhan and who was buying them. The data indicates there was a dramatic increase of PCR procurement contracts in 2019 in Wuhan. The amount of money spent on that equipment also increased enormously during that time. In 2015, 10 million yuan. In 2016, 19 million. Then in 2017, it increases to 29 million yuan, 2018, 36.7 million, and in 2019, 67.4 million yuan. That 2019 contract value is more than the sum of the previous 2 years. The data shows the significant increase in PCR purchasing actually starts in July 2019. And this is fascinating because former Secretary of State Mike Pompeo, he's also former director of the CIA, he told me that he thinks the outbreak of COVID-19 may have started as early as July or August that year. What does that indicate to you about the origins of the virus and whether an outbreak might have occurred or become known to the Wuhan Institute of Virology at that early date?
So I've seen data points that place it in the summertime of 2019, late summer, July, August of 2019. These are all parts of the pieces, right? This is all the cumulative weight of the evidence that suggests that it did come from this lab.
Drilling down on exactly who was buying the PCR coronavirus equipment in 2019, the official Chinese government procurement data shows the buyers included the People's Liberation Army Airborne Hospital, which bought PCR equipment as early as May 2019, and the Hubei Province District Centres for Disease Control and Prevention. They also bought coronavirus testing machines. Now, this data, this official Chinese government procurement data, has only come to light because of the team at Internet 2.0. It had virtually been expunged from the internet and they were able to recover it. They've previously done work for the Australian and American governments, and now they've passed this new information onto the intelligence agencies. Cybersecurity analysts Robert Potter and Dave Robertson join me now. Welcome to you both. Robert, firstly, how did you uncover this data that had been virtually wiped from the internet?
Well, thanks for the question, Sharri. It's really good to be back here. It was a process that involved starting with the assumption that the wipe would never have been complete because there was just too much information to get rid of. So the team spent months using multiple sources of web archives to restore multiple points of data so that we had high confidence in the numbers when we were finally ready to present them. It took about 6 months for the team to reconstruct the data using web archive pages, open source procurement systems that are still currently live on the internet, as well as other sources that were more closed source. And taken together, they all point to the same trend.
This is an extraordinary amount of work, David. What do you think this data can tell us about when the outbreak actually began?
Hi, Sharri. The outbreak is able to be predicted with predictive statistics on a bracket or a window months before the WHO were informed about COVID-19 from China by tracking the PCR procurement contracts and giving us the bracket or window between July and October 2019.
I mean, this really sets the outbreak back earlier than anyone has said publicly, other than that amazing revelation from the former Secretary of State, Mike Pompeo. Robert, just looking at the actual data, when in 2019 does the increase in PCR machines kick off? And what does the data show us about who specifically was buying the machines in 2019?
Well, it doesn't give us one particular data point where we can hang our hat and say it started there, but you can see across the trend that starting in May through all the way to December, and then a massive increase, obviously, in 2020 as well. You see a massive increase in the procurement of PCR testing equipment. Some of this may be benign, but taken together, it gives us a trend that comprehensively challenges the official narrative that the pandemic started in December. Along with that, when you see who's buying it, you're seeing individual procurement items coming out of the Wuhan Institute of Virology itself. That one's been well studied both in your documentary and in other places as well. It also shows that there's a significant amount of procurement from the government level, the PLA, and the Centre for Disease Control, as well as sensitive laboratories that are in Hubei province.
David, I think it's worth mentioning you're a former Australian intelligence officer. You're now based overseas. One of the notable contracts was that the Wuhan Hongshan District Centre made 2 purchases of the pathogen detection equipment for the military games. Now, they announced this procurement on the 21st of September 2019. How were you able to verify, or how do we know that they were buying this for the military games?
Sharri, the contract specifically noted that they were for the military games, so the entire title of the contract was directed on the reason for that purchase.
That's quite extraordinary, don't you think, that they were, why would they have been buying this equipment for the military games?
We noted that contract as abnormal, significant and out of trend, definitely.
Robert, there was also an increase in the animal testing bureaus from July through to December. Again, why would they have been buying coronavirus testing equipment? What does this indicate to you?
Well, it shows that there's a lot of investigation going on in Hubei province at the time. You're seeing a large amount of testing where we weren't, at the beginning of the pandemic, entirely certain how the disease was spreading. So it makes sense that they would be testing a fair amount of animals in Wuhan at the time to see whether or not the disease was travelling from humans to animals or from animals to humans.
Yeah, so it's fascinating that, again, this was beginning before China admitted there was any outbreak. David, another fascinating insight, the People's Liberation Army Airborne Hospital, they issued a tender for a PCR machine or PCR equipment on the 27th of May. That's one of the earliest records in 2019. But then the equipment ended up being gifted at no cost at all to the People's Liberation Army. I mean, what do you make of that?
So the gifting of contracts to the People's Liberation Army is actually kind of normal. But the fact that it was the only PCR purchased by the PLA we could find in the entire data set, and the fact that it was significant out of trend and in May 2019 from Sinopharm, which was the Chinese government state-owned asset organisation that made the coronavirus vaccine for China, we thought that was quite abnormal.
Look, just finally, Robert, I mean, this data is quite significant. You've passed it on to intelligence agencies for formal analysis. What sort of investigation do you think needs to be undertaken from this point to properly understand what these official Chinese government procurement records mean and what it does indicate about when the virus broke out?
Well, it shows that we've listened quite extensively to what the Chinese government said about the beginning of the outbreak. What we wanted to do here was test what they were actually doing and to look deeply into the procurement system on a single item that stands out when you need to treat a large number of people or test a large number of people. And so it was a particular piece of procurement that we could assess to see what the trend would look like, establish what normal looked like, and then look for changes in that trend. There are still multiple other items of procurement, such as ventilators, that could be assessed in exactly the same way. So what I think this does is it, rather than decisively concluding where the beginning of the pandemic came from, produces a new avenue for us to investigate and opens up a new range of possibilities for other people using this data, which will make available to those who need it, to go through and assess other variables, to dig to the bottom of this in the way that we have with PCR testing equipment.
And did you both get the sense that the intelligence agencies are keen to continue investigations, and they were keen to look at what your data shows, David?
Sarah, I think the whole public is actually keen to know what happened in Wuhan and what the origins of the virus are and when China knew specifically, because there's a lot of commentary for the last 18 months about the likelihood we could have stopped the pandemic if we knew earlier.
Yeah, absolutely. David Robertson and Robert Potter, thank you so much for your really important work on this area. It's just so critical to have experts like you drilling down into what China was doing in this time frame. So we really appreciate it.
Thanks, Sharri.
Thank you, Sharri.